Hello, my name is Eric Prosher, and I represent Jesse Brown VA Medical Center. I'm also with a colleague that is our special guest on our Veterans Issue show. Her name is Dr. Madeline Ofina, and you're watching a live call-in interactive program brought to you by CAN TV 21. And during the next 25 minutes, we're going to be discussing the recovery movement, the recovery model at Jesse Brown VA Medical Center. So please call in with your questions. This is live, so call in 312-738-1060. Our phone lines are now open. Hello, Dr. Ofina.
Hi, how are you?
Did I say that correctly?
Yes, you did.
All right. Well, thank you for coming on and telling us a little bit about your position. First, I wanted to welcome you not only to our CAN TV program, but I wanted to welcome you to Jesse Brown VA. I know you've been there for a little bit, but why don't you tell us a little bit about what your background is, how you got to Jesse Brown, and what your role is as the local recovery coordinator.
Yes. Okay, great. So I'm the local recovery coordinator, as you said. I have my PhD in clinical psychology, and a lot of my training has been around the recovery model and the wellness and recovery model. And so this model has actually been around for quite some time. I started my training in San Francisco, in which I work with the county over there and helping the practitioners move towards this model, which we'll be talking about.
Yes.
And then I worked and trained at the VA in San Francisco, working on the inpatient unit there.
Okay.
And then also the VA in Detroit.
Great.
Which led me here to Chicago.
Hoorah. Just left my on vacation last week with my little sister that is from Detroit.
Right.
So go Detroit.
Yeah. So a part of my role is to work within the VA mental health system to support the staff members in the clinics in moving towards this model of care, which is for some providers a switch in how to understand treatment for veterans.
Yes. So a switch, and so when we're talking about the recovery model, are we talking specifically what we call mental health or psychological conditions, or does that include other areas of medicine?
Right. So that's a good question. So the recovery model actually is also really frequently mixed up with, the recovery model of mental health is frequently mixed up with the addiction model of recovery. Mm-hmm. And so those two things frequently get sort of confused. And so this model in particular is really focused on the mental health aspect. Not to say that those two things are mutually exclusive, but my role is less of addictions and substance use and more of mental health care and treatment. And it's not just for those with serious mental illness, such as schizophrenia, depression, or bipolar disorder. It actually can be applied to anybody who has a mental illness and who experience maybe stigma or the negative effects that occur because of mental health, because of a mental health diagnosis.
Wow. So your job within the VA system, within our facility, is to win hearts and minds of providers and practitioners to offer another way to look at how we would assist a veteran struggling with mental health issues to return to or move on in their life to flourish in a way that fits their values, desires, needs, and wishes?
Yes, so there's actually one local recovery coordinator in every VA.
Okay.
And our role is to help change the culture or support the culture that's already in place that's consistent with the model. So the assumption isn't that these providers aren't doing this. The assumption is that my role is to help and support in any way possible. So while this model was rolled out back in 2002 with the President's New Freedom Commission, most providers are actually providing care within this model, but they just may not realize it.
Yeah. Well, I mean, it's there are a number of newer initiatives in the VA, and the patient-centered care is another one that is kind of flipping the script and changing traditional modes of care to one that is centered around veterans' needs and values. And recovery model seems like it they've been doing that for a long time.
Yes.
And that they're kindred spirits.
Right. So I worked with the Office of Patient-Centered Care, and their role is more towards, I guess, hospital-wide, more also in the physical health field. And the recovery model is a little bit different because it's not just patient-centered care, it's also recognizing veterans' strengths, including them in treatment, thinking about how they can identify meaningful roles that they can integrate into their own treatment, and just making more of a person-centered approach in addition to just patient-centered care.
Okay.
Right.
Well, let's, I have an overhead to kind of, maybe to give the viewers at home another way to look at some of the differences between the recovery model and traditional models that have been used in mental health. So on your screen at home, you'll see on the left, you have the traditional models that disabilities are define the treatment, and that's opposed to wellness and recovery model where abilities define the treatment. What does that mean?
Right. So within this model, when we look at care, we think of what is this person's strengths? What can they bring to their own treatment, and how can we capitalize on that and move forward with their care in that way, versus this person can't do X, Y, and Z, so this is what we can do with them as a result. So it's sort of looking at it through a strengths-based model. And, you know, looking at the comparison, and again, this model was developed by Mark Reagans back in the Village in Long Beach. There are differences. So again, so abilities define treatment. It's more of a natural setting versus an institutional setting. So within this model, one of the key aspects that's frequently overlooked is the focus on integrating people into the community. So we don't necessarily want people just to, you know, stay within the VA. That's their entire life. It's no. Well, what did you have? What makes you feel fulfilled? You know, if that's, I don't know, bowling, or if that's connecting back with your family, how can we help you do that? And how that ties in with mental health care is that, okay, so you want to connect back with your family. What do you need to do that? And for a lot of people, it's, I want to be able to, you know, manage my anxiety when I'm in a room. I want to be able to deal with my anger when, you know, my cousin comes up and, you know, makes me angry. And so there are differences that are there. And it's also very much addressed, very much focused on sort of this wellness and health focus, and really interested in trying to help the person identify what it is that they want, and using, you know, helping them identify their own strengths in this process.
Cool.
Right.
So where does a model like this come from? What do you know the history of the recovery model, and who thinks of something like this relative to the traditional paradigm or the norms of psychiatry and psychology and mental health?
Yeah, so that's a tough question. So historically, this has actually come from, you know, the 60s and the 70s. You know, moving forward, it's sort of morphed into different things. So it came from sort of the rehabilitation model and looking at things in sort of this medical model way, and switching it over towards this model of care. I think within the VA, it became more recognized back in 2002. However, you know, there's research articles dating back from the 90s with Anthony Williams, you know, citing this idea of recovery-oriented approach. And part of it came as a result of the deinstitutionalization of people, you know, back when there were these big asylums. Yeah, back when there were these big asylums, you know, all these people said, well, you know, we shouldn't, you know, it was expensive, we shouldn't house them for whatever reason. And so they went back into the community, and unfortunately, there wasn't enough support. And so the question was, you know, how can we help integrate these people into the community? Fast forward, I mean, a lot of things happen between now and then, but fast forward to now, and now it's really this recovery model addresses, you know, what has happened as a result of that. So a big piece of it is the stigma that's tied with mental illness. And this is why this isn't only something that can be applied to just a serious mental illness, although those with serious mental illness are probably the most impacted. These can be with people, with any person with mental illness. I mean, there's a huge amount of stigma that occurs. I mean, it's difficult to get people, even in the door sometimes to say that or to even, admit to themselves that they're seeing
Yeah.
a provider. So that's pretty prevalent.
I imagine it might be doubly hard. For those of you that have just joined us, my name's Eric Prosher. This is Dr. Ofina, and we're from Jesse Brown VA Medical Center, located at 820 South Damon Avenue. And we are talking about the recovery model and mental illness. And so we work with veterans, and you mentioned the word stigma, and I work in a clinic with newer veterans coming back from combat missions from Iraq and Afghanistan.
Right.
And stigma is often cited as a big concern that prevents people from getting help. That there are these kind of stereotypes out in our culture about the wounded, vet that comes back, or the invisible wounds of war, and how that negatively impacts their lives. So veterans are fearful of putting any information on resumes that would where potential employers could discriminate them against them. Is this the type of stigma that you're talking about, or there's also stigma, I guess, connected to mental illness itself? And I've noticed that over the years in our clinic, at first people were concerned about being diagnosed, especially with PTSD, because some of the PTSD and depression and anxiety and major depression, bipolar disorder can end military careers. However, I noticed the VA and the Department of Defense it seems like they've done a better job, in the sense, just anecdotally in my relationship with the veterans that I work with, that many veterans come to me and they're like expecting to get a PTSD diagnosis, and when I say, well, that's not PTSD, you have anxiety or you have depression, they're like, no, and they get upset, somehow like, wow, somehow PTSD has gained some kind of special elevation among the acceptable diagnoses versus other. Have you noticed that, or do you have any comments about that?
Right. So with diagnosis, there is a lot of things that occur. There's things that can affect the person, both sort of internally and then within the public. One of the groups that we do here at Jesse Brown is, it's called Ending Self-Stigma, and it was a group that was developed out of the University of Maryland and the San Francisco VA.
Great.
And
Doctor, we have a caller, and we haven't got a caller so far, but I want to hear about that group. But let's take a question first. Hello, caller. What is your question? You're here with Dr. Ofina from Jesse Brown VA.
Hi.
Hi.
I have a question. I have a cousin who has schizophrenia, and she's had it for a long time. She takes medications, and I think it helps. But how does someone recover from something like that has no cure?
Oh, so the question is, how does someone with a severe mental illness like schizophrenia recover when there supposedly might not be a cure for schizophrenia?
Yeah, I think she'll always have it. The medications help, but she still has it.
So that's a good question. So recovery doesn't necessarily mean cure, and I think that's a common question that comes up. Recovery really means living the life that you want. And so sometimes it's stigma. The assumption is that because you have a diagnosis, say schizophrenia, and you're experiencing the symptoms associated with that you can't live the life that you want, that maybe you can't get a job, that you can't do X, Y, and Z. So within this model, the idea is, yes, you can, and there are ways to do that through coping strategies. And so I guess to sort of answer your question is that you can recover with a mental health diagnosis, and the idea of recovery is living the life to your fullest potential and living the life that you want. And so helping your cousin kind of regain and identify what it is that she values in her life and help her move in that direction. But thanks for your question.
Okay. Yeah, thank you.
Does that make sense? Okay, thank you.
Thank you.
Cool. If you have any other questions, call back. All right, so
We were talking about,
we were
group.
talking about stigma, and
Mhm.
that color kind of raised one of the issues kind of connected to stigma, is that there are a whole host of ideas and assumptions about certain diagnoses, and some people, for example, schizophrenia, the idea was like, oh, somehow this this person, we have to have low expectations that they can't function
yeah.
the way that other people do because they have a diagnosis.
Right. And it's actually, this is a conversation that I had with some people today, so today I actually had a conversation about stigma and schizophrenia, and the question was, why is it that people think that I can't do the things that I want to do in my life? And it's something that comes up, and I think that when stigma becomes problematic is when the veteran or the person starts to internalize it and believe it within themselves. And so that's part of the reason why we have this group within the VA and multiple clinics. It's addressing the concerns that come up when the public has these ideas about a person and who they are because of this diagnosis, and realizing that this is really just a label to help providers communicate and to help kind of categorize just for treatment's sake. So this isn't an identity, and sometimes that can happen. And what you're looking at now is this diagram that was developed within the VA, within one of the LRCs, so I can't take credit for it. But these are the main components of recovery as identified by SAMHSA. And yeah, Pat Deegan. And this, if you look at this model, there's all these different parts of recovery. So the biggest part that I want to emphasize is the red section, which is hope. So the belief that you can recover, and the belief for the veteran, for the VA staff to recognize that people, do and can recover from the mental illness. But again, like I said to the caller, recovery doesn't equal cure. Recovery means living your life to your fullest potential. The other piece is person-driven, which is very consistent with sort of the patient-centered care that we talk about. One of the biggest pieces is the idea that recovery isn't linear. So I always like to use this question when I discuss this with people, but if you've ever tried to lose weight or get in shape, have you ever, done it right the first time? For most people, no. Some people spend, just try to lose weight multiple times, and that's okay because that's a process. And so recovery is a process. So a big part of this model is recognizing that there may be periods of relapse or going back into crises, and that's just part of the process, that our expectations should recognize that. And a big piece of it is also just recognizing the individual's culture and who they are, and integrate that into treatment. So within this model, treatment is very individualized. There's no cookie cutter approach because no person just sort of fits within this cookie cutter mold. And so that's something that's really important.
Great. Well, there's a video that you were telling me about. Maybe you want to set this up?
Being in the
Yes. So do you want to introduce this person?
Yes.
So this is Pat Deegan. So Pat Deegan is a psychologist, and as you'll find in the video, she was diagnosed with schizophrenia when she was a teenager. So she is currently a consultant working with many mental health organizations within this model, and has won awards both in the APA and nationally.
All right.
hospital, literally within a day, I was diagnosed with schizophrenia, undifferentiated type, with paranoid features. And that became the diagnosis, and that diagnosis took on what I call a master status in terms of my identity. The fact that I was Pat, the fact that there were many aspects to who I was as a person became absolutely irrelevant once I held this label, this diagnosis. What mattered was that I was a quote-unquote schizophrenic. In other words, my humanity seemed to others to be quite secondary. So the fact that I had friends, the fact that I was a good athlete, none of this seemed to matter. It was like wearing a scarlet letter in big neon lights. This is a disease, not a person. This is a disorder, not a person. So he felt like he knew my future. He had read a generic textbook and simply applied it to the case in front of him. Schizophrenics don't recover, Pat Deegan won't recover. And it was that simple. And he urged me to go into a halfway house and to go on Social Security and to essentially retire from life. And then I remember having a thought. And I had never had this thought before, but the thought came to me, I'm going to become Dr. Deegan and change the mental health system so that no one ever gets hurt in it again. Wow. That thought had never come to me before. And yet, it held me with a power. It became for me what I call a survivor's mission. In my own understanding of it, I believe that I have been called by a power greater than myself to do the work that has become my life work. I do not tell that to psychiatrists or treatment teams when I meet them. Miss Deegan, if I had gone to the treatment team then, Miss Deegan, what is your goal for your treatment planning this year? Well, doctor, I have been called by God to change the mental health system so that no one ever gets hurt in it again. Delusions of grandeur. Up the haloperidol. So I kept this new dream, this new survivor's mission to myself. It became mine. It became something that around which I could organize my recovery. And I think that this is so important, that you can't organize a recovery around a vacuum. You can't organize recovery around nothingness. We need to organize our recovery around something that has meaning, something that has purpose, something that gives us a sense that I can begin to move.
Wow, so that seems like a really good spot to highlight here. Mm-hmm. By the way, not what you expect someone with a diagnosis with schizophrenia. But she says recovery can't happen in a vacuum. It has to be organized with values, belief, mission, function. Mm-hmm. Yes?
Yes.
So what are some last words that we can leave with the audience? How do people get in touch with someone like yourself at the VA?
Sure.
What would be the
avenue?
optimal route, or do you have direct contact with
The community?
with community?
So I do. And so I am starting to, like Dr. Prosher said, I'm relatively new here, and so I'm trying to get to know all of the community programs. And so, a way to get a hold of me is just to, call up the VA and just give me a call. I'm the only Dr. Ofina within the system.
Okay.
So that I'll be the only person there. The one thing, if the take-home message that I wanted to kind of leave with everybody is the idea that recovery is possible, and that, if you are in need of help, the VA, and you are a veteran and you qualify, so the VA is, really working towards being really committed to this mission, and really helping veterans in a really individualized way. And so, although stigma can sometimes be a barrier, I really encourage anybody who needs mental health care to seek it out.
Thank you so much for coming on the show. I'm Eric Prosher. This is Dr. Ofina, Dr. Maddie Ofina, and we represent Jesse Brown VA. We'd like to thank you for watching CAN TV 21, and you can learn about Jesse Brown by contacting us at 312-569-VETS, VETS. And please tune in March 23rd. We'll be back again on Veterans Issues, CAN TV 21. Also, I want a quick reminder, it is still flu season, and and the flu is nasty, and by getting the flu vaccine, you can still protect yourself, and we have free vaccines for all veterans at Jesse Brown VA. So come by Monday through Friday, 8:30 to 4, room 1458, first floor, Damon. Stop the Flu. It starts with you. Stay tuned for Fathers Who Care, who follow us in 5 minutes. Goodbye for now.